So what we're going to take a look at is the application of acupressure. There's a number of techniques that can be applied. You can apply it with different parts of the body, particularly elbows, side of the knuckle on the side of your hand. You can either use your knuckles to actually apply the pressure, finger pressure, or thumb pressure. You can also use one of these devices, which are quite useful for applying pressure, so you can actually get that and apply the pressure in that manner, get your body weight behind it, particularly if you're applying it on yourself or on a patient and you've got quite a muscular patient. Again, you've got pencils, either pencil with a rubber on the end, or this one's got a nice smooth end, particularly if you're going to be applying pressure to yourself. If I'm going to say, for example, I'm going to apply on my large intestine 20, I can use the pencil and apply the pressure in that manner. So pressure can actually be applied by different implements, different devices, more so something blunt and smooth end. That's not going to be uncomfortable to the patient. So they're the best things to actually use. Now, when actually applying the pressure, again, different techniques, and it depends as to what you're applying the pressure to. If I'm going to apply pressure to a myofascial trigger point, for example, what I'm going to basically do is to put the muscle onto a slight stretch, locate the myofascial trigger point, and apply pressure. So I go in gently with the pressure until I can feel more or less the tension in there. I gauge it to the patient's level of discomfort, 0 being no pain, 10 being excruciating. So what we'd want to be gauging is around about 6 to 7. If it's anything over and above that, then the patient's going to tense up, probably hold the breath, and the tension is not going to come out of the muscle. So again, it's more or less applying sufficient pressure, not to cause a patient too much discomfort, but more or less to deactivate the trigger point. So in that case, what you're going to basically do is to gently apply the pressure until it gets to a certain level and hold it. And then keep that pressure and maintain that pressure, anything from up to 30 seconds, and in some cases it will state up to 90 seconds depending as to how long it takes to deactivate that particular trigger point. So that's more or less the treatment of the actual trigger point in itself. However, if you're actually treating an acupressure point, slightly different technique. So in this case, again, you can either go in and hold the pressure. What I tend to recommend is to locate, say for example, what we're going to do now is locate your urinary bladder 23. I can put one thumb on top of the other thumb, and then I'm going to apply pressure that way, and then I'm going to do small circular movements onto there. So those small circular movements will allow me to get sufficient pressure into that area. And again, you can stimulate. Different literature will give you different stimulation time. I normally recommend to stimulate up to a minute. However, some literature will turn around and say anything up to 5 minutes. So ideally, you are looking at anything between 1 and 5 minutes. You can do, say, for example, a minute on one point, then move on to another point, and then come back and do another minute on those points and do it that way. But however, I would normally say stimulate for at least a minute to get your optimum result. Again, the type of pressure you want to be applying needs to be firm enough where the patient isn't going to find it discomfort or painful, but what some people report is a pleasurable pain. So it might cause a little bit of discomfort, but it's a nice discomfort. If it's an unpleasant discomfort, then that is too much. So again, it does need to be felt in one respect, but not causing the patient any real pain as such. As I was stating beforehand, if I'm going to do anywhere in and around the glute region, then in most cases I'll use my elbow, and I can come in and utilize my elbow in that manner, and again I can come in and do circular motion with my elbow. So different ways of actually applying it. Now, one of the most important thing is when you are applying pressure is your posture, your positioning, as to how you position yourself in order to get the right amount of pressure on. Try not to apply the pressure directly with the hand. Try and utilize your body weight, for example. So what you can actually do is to more or less extend your arm, lock your arm out, locate the point, and what you're going to do now is to lean into it. So now I'm utilizing my arms where it's locked out, and I'm utilizing my body weight in order to apply the pressure. That means I can apply the pressure for any length of time and maintain that pressure without trying to apply it with my arms and then start to shake as I start to fatigue trying to maintain that pressure. So therefore I'm utilizing as little energy as possible, and I'm not straining any muscles or putting myself into an awkward or a compromising position in order to get the right amount of pressure on there. So that's going to be quite important to be able to do that. If you are applying finger pressure, you can do one of two things: either use your index finger and then use your middle finger on top to get sufficient pressure on, and then do your small circular motion, or you can use your index finger and then use your thumb or your other index finger on top to get sufficient pressure on. So there's different methods. Thumbs, again, you could use both thumbs, one thumb on top of the other, rest your weight on there and get your pressure on. So different methods of applying pressure and getting sufficient amount of pressure into the area to get your optimum results.